We have one pro talk scheduled. Sorry to interrupt everyone. We got a quick pro talk scheduled right now, but I do want to give another round of applause to the panel. They did such a great job. I wish we had an AI scribe to record it. So when it comes to interoperability, we all know that it's not just about connecting systems, it's about connecting systems with confidence. So our next pro talk, Building Confidence Through Conformance, Advancing Interoperability Across Canada, looks at how Infoway's national efforts, from projectathons to conformance, are turning standards into seamless collaboration. Please join me in welcoming Infoway's Andrew Liu, Vice President of Architecture, Delivery, and Conformance.
Yeah, I got it. Yeah. Thank you, Edwin. First of all, I'd like to thank Infoway team for putting me in between 300 people and lunch. So I'll keep this short and sweet. Really, just wanted to, this is working, yeah. Just wanted to provide an update, a couple of announcements really on the progress we made on the National Conformance Program. As we know, Canada's journey towards a more connected, patient-centered health system depends on trust, collaboration, and also real-world validation. First announcement, we're doing it again. Yes, Project Song. Why? Because, we had a great success earlier this year in February. We had the very first in-person North America Connect-a-thon and the third Canadian Project-a-thon is very well participated. I think we had a room maybe twice as big as this one, filled with architects and developers and firesmiths, and the feedback was overwhelming. A few key successes from the recent Project-a-thons. Number one, public-private collaboration. Next slide, we'll see the organization that have participated. Really is well represented of provinces and vendors. And the other thing is the value of a Project-a-thon is fast-tracking adoption. Really, you got different vendors, provincial implementers, and moderators all at the test floor, right? If there's any problems, something failed test, we can debug right there, right? Figure out whose problem it was and who interpreted the requirement wrong. Also, we're getting feedback on the standards themselves, right? Because nothing is perfect. We might have overlooked certain things, and we're taking the feedback on the specifications. And then we achieve alignments between the stakeholders, right? Jurisdictions and vendors. So this is participants in the February Project-a-thon. And we had 3 PTs and 20 vendors. So on that test floor, over 4.5 days, we had 400,000 test messages exchanged, 700 tests completed, and close to 300 peer-to-peer. And these are some of the testimonials from the participants, right? Regarding the structure, the methodology, the confidence that it gave the participants on their systems and their implementation. And also, we had a US organization participated in the patient summary test. And also, the purple one that came from, from a PT participant. And he said we were able to do in a week what we would have taken months to deliver, right? Because the vendors were there. So we just kick off the 2026 Project-a-thon, and this is a timeline. We had a registration webinar back in October. We had close to 80 people participated, and from 30 organizations. And there was about 17, 18 people who did not identify their organization. We're in the process of tracking them down. The registration period runs from October to December 19th, right? So that's a key timeline there. We already have a few organizations registered. If you're still thinking about it, stop thinking and sign up. Yeah. We are going to open up the pre-product sound testing period, right? So it's mostly no-peer self-testing against our simulators and validators. And that's going to go from January 8th to February 20th. The actual product sound is going to be a virtual event, 3 days, from February 24th to 26th, and it's free. In March, we're going to publish the product sound test report, right? Very much like the past 3 product sounds. We're going to identify the organization, the test profiles that you have tested, and the result of the test. So here's the QR code. Register and register. So the next thing is the announcement of the launching of a Pan-Canadian Conformance Platform. So what it is, really we're trying to establish a national centralized service, right, that supports 2 keywords, self-served and automated. The reason? Because of these challenges, right? Because, across the country for all the jurisdictions, the budget and resource and tooling on conformance is limited. And also, the approach that different organizations or jurisdictions taken towards conformance is not consistent, right? There's duplication across different organizations, and also sometimes it makes it hard for the vendors, right? They have to deal with this inconsistency, and it takes a long time for them to get that stamp on their solutions. So our solution is really aiming to simplify the conformance, right? Because the vendors and the industry is used to the continued build and integration, right? So we're providing this 24/7 self-test automated platform so that the development team from the implementers and vendors, they could incorporate this service into their development process so they can test often, test early, and then ensure the solution readiness before deployment. And also the scalable national platform, right, will reduce the redundancy and the manual conformance testing. And in terms of value proposition, right, I already covered some of it. Really, for the vendors and solution providers, we're hoping to make it easier, right, so that they could test early and often, and also they could validate their conformance against Pan-Canadian specifications before jurisdictional reviews, and also they gain competitive advantage as a certified solution. For jurisdictions, the vendors, they can leverage this service, right? They know the vendors, and they can require the vendors to be pre-validated against national requirements and national standards, and also it helps them streamlining the procurement and onboarding process and focus their resource on implementation, not conformance. In terms of the value it brings to Canadians and the health system, we hope all the reduction on redundancy and accelerate the implementation and deployment process, it could bring faster innovation, connected and efficient care, healthcare to Canadians, and so that innovation reaches patients and providers sooner. And also better interoperability means the seamless care transitions, coordination of care, and patient and provider access to data. So we are doing a webinar early December. I believe December 10th is the date. We're going to do a demo of the conformance platform, the initial release, what it covers, right? Patient summary, Canadian Fire Exchange spec, and all that. And here's the QR code. Please register. And we're going to also work through how we onboard systems and organizations to that platform. time for lunch. Thank you.
Thank you so much, Andrew. Lunch will be available in the Oh yeah, you're right. That was my fault, the slide. Lunch will be available in the Verchier room, proudly sponsored by Clinic Connects. Please take time to enjoy this meal, continue the conversations, and network with colleagues. We also, I know some people have been asking if we can get a flat white somewhere or a cortado. We have a barista in the back if you guys want to get something a little bit more with a little bit more kick. And we'll see you back here at 1:30 p.m. once everyone's system's recharged. Thank you again.